This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now look at the notes for Extract 1.
Extract 1, questions 1 to 12. You will hear a conversation that takes place in a doctor's clinic where Mr. James Reynolds, a 52-year-old high school teacher, consults his doctor about persistent chest discomfort. For questions 1 to 12, fill in the blanks in the notes with a word or brief phrase. You now have 30 seconds to review the notes.
Good morning, Mr. Reynolds. What brings you in today?
Good morning. I've been feeling a tight, uncomfortable sensation in my chest for the past 3 weeks. It's not exactly painful, but it gets worse when I exert myself, like when I climb stairs.
I see. Have you noticed any other symptoms along with the chest discomfort?
Yes, sometimes I feel a bit short of breath, especially after walking uphill. And in the mornings, I occasionally feel a bit dizzy.
That's important to note. Have you felt any pain spreading to your arms, jaw, or back?
No, nothing like that. It just stays in my chest.
Understood. Now, let's go over your medical history. I see you've had high blood pressure for 5 years, and your cholesterol has been borderline high for 3 years. Have you had any previous heart issues or lung problems?
No, nothing serious before this, just the hypertension and cholesterol concerns.
And you're currently taking amlodipine for blood pressure and atorvastatin for cholesterol, correct? Yes.
Yes, that's right. I take them both once a day.
Good. Now, let's discuss your lifestyle. Do you smoke or drink alcohol?
Yes, I've been smoking about 10 cigarettes a day for the last 25 years. I do drink occasionally, maybe once or twice a month.
I see. And what about your diet?
Well, it's not the healthiest. I eat a lot of processed foods, and I know I don't get enough vegetables.
And your physical activity level?
Honestly, it's quite low. Teaching keeps me on my feet during the day, but I don't do any structured exercise.
Thank you for sharing all that. Now, let's look at your family history. Did either of your parents have heart conditions?
Yes, my father had a heart attack at 58. My mother developed type 2 diabetes in her late 60s.
Given your symptoms and risk factors, I'm concerned that this could be angina, which is often a warning sign of reduced blood flow to the heart. We need to investigate further.
That sounds serious. What tests do I need?
I'd like to start with an ECG to check your heart's electrical activity, a lipid profile to assess your cholesterol levels, and a stress test to see how your heart responds to exertion.
Okay, that makes sense. What about treatment?
In the meantime, I'll prescribe a low-dose aspirin, 75 milligrams daily, to help reduce your risk of a heart attack. But lifestyle changes will also be crucial.
What changes should I make?
First, smoking cessation is a top priority. Smoking significantly increases your heart disease risk. I can refer you to a smoking cessation program if you'd like support.
I know I need to quit. I've tried before, but it's tough. Maybe a program would help.
That's a great step. We'll also need to improve your diet by incorporating more fresh vegetables and cutting down on processed foods. And I'd recommend gradually increasing your physical activity, even if it's just a short daily walk to start with.
That sounds doable. How soon should I come back?
Let's schedule a follow-up in 2 weeks to review your test results and discuss any treatment adjustments. In the meantime, if your chest discomfort worsens, especially if it happens at rest or lasts longer, seek medical help immediately.
All right, I understand. Thank you for explaining everything.
You're very welcome, Mr. Reynolds. I know this can be worrying, but we're catching it early, and with the right steps, we can manage it well. Take care, and I'll see you in 2 weeks.
Extract 2, questions 13 to 24. You will hear a conversation that takes place in a hospital emergency department where Sarah Mitchell, a 28-year-old marketing executive, consults a doctor about persistent lower right abdominal pain. For questions 13 to 24, fill in the blanks in the notes using a word or short phrase. You now have 30 seconds to review the notes.
Good morning, Miss Mitchell. What seems to be the problem today?
Good morning, doctor. I've been having this dull pain in my lower right abdomen for the past 2 days, and it's getting worse.
I see. Could you describe the pain? Is it sharp, cramping, or constant?
It started as a mild discomfort, but now it's more of a sharp pain, especially when I move around or cough.
Have you noticed any other symptoms?
Yes, I feel nauseous. I haven't had much of an appetite, and I've been running a slight fever.
That's important to note. Have you had any changes in your bowel habits, diarrhea, constipation, or bloating?
Not really. I have mild IBS, so I sometimes get bloated, but nothing unusual recently.
All right. Have you had any previous surgeries or medical conditions that I should be aware of?
No, I've never had surgery, and apart from IBS, I haven't had any serious illnesses.
Are you currently on any medications?
It's the occasional antacid when I get heartburn.
Understood. Let's talk about your lifestyle. Do you smoke or drink alcohol?
I don't smoke, but I do have a drink occasionally, maybe once or twice a month.
And how would you describe your diet?
Honestly, I eat a lot of takeout and processed food because of my busy schedule. I know it's not the healthiest.
I see. What about your physical activity level?
It's pretty low. I sit at my desk most of the day and I don't get much exercise.
Thanks for sharing that. Now, let's check your family history. Any history of gastrointestinal disorders?
No, nothing like that. But my dad has type 2 diabetes.
All right. Based on your symptoms and physical exam, I'm concerned that this might be appendicitis. It's an inflammation of the appendix, and if left untreated, it could lead to complications.
Oh, that sounds serious. What do I need to do?
We need to confirm the diagnosis with an abdominal ultrasound and blood test to check for infection. If the test suggests appendicitis, surgery may be necessary to remove the appendix before it worsens.
Surgery? That sounds scary. Is there any other treatment?
If it's confirmed as appendicitis, surgery is the best option to prevent complications like rupture. But we'll assess your results first before making a final decision. In the meantime, I'm putting you on NPO status, meaning no food or drinks, in case surgery is needed. We'll also start IV fluids to keep you hydrated.
I understand. When will I know for sure?
We should have the test results within a few hours. If it is appendicitis, we'll proceed with surgery as soon as possible.
Okay. I'm nervous, but I trust your judgment.
I know this can be worrying, but we're catching it early, which is the best scenario. Try to rest, and we'll keep you informed every step of the way.
Thank you. I appreciate that.
You're very welcome. We'll take good care of you.
Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B or C, which fits best according to what you hear. Now look at question 25.
Mr. Lawson, this medication should help regulate your blood pressure, but let's go over some possible side effects. Some people feel a bit lightheaded, especially when standing up quickly. If that happens, just take a moment before moving. A few patients also report a dry cough, which isn't serious but can be persistent. If that becomes bothersome, let me know and we'll discuss alternatives. You shouldn't stop the medication abruptly, though, as that could cause your blood pressure to spike. It's also important to take it at the same time each day, preferably in the morning. Any concerns?
Now look at question 26.
Now, let's go over proper hand hygiene. Always use an alcohol-based hand rub before and after patient contact. It's the most effective way to prevent infections. However, if your hands are visibly soiled, hand rub won't be enough. In that case, you must wash with soap and water. A common mistake is assuming gloves eliminate the need for hand hygiene. In reality, you should clean your hands before putting on gloves and after removing them, because gloves can carry germs. And while hand rub is usually sufficient, remember that certain infections like C. difficile require soap and water. Any questions?
Now look at question 27.
Mrs. Green, your antibiotic course is for 7 days. It's crucial that you complete the full course, even if you feel better, after 2 or 3 days. Stopping early could allow the infection to return, and more importantly, it can lead to antibiotic resistance. Now, take 1 capsule every 12 hours. Try to take it with food to prevent stomach irritation, but if you forget, don't double up on the next dose. Also, avoid alcohol while taking this medication, as it can make side effects like dizziness and nausea worse. If you experience a severe rash, persistent vomiting, or swelling of the lips, stop taking it and contact your doctor immediately.
Now look at question 28.
Mr. Evans, managing your blood sugar isn't just about medication. Lifestyle plays a huge role. Focus on eating fiber-rich foods like vegetables and whole grains. These help regulate blood sugar. At the same time, try to cut back on processed foods and anything high in sugar. Now, exercise doesn't have to mean intense workouts. Even just a 30-minute walk daily can help stabilize your glucose levels. It's also best to drink more water and reduce sugary drinks, including fruit juices, which some people mistake as healthy. Would you like me to refer you to a dietitian for more tailored advice?
Now look at question 29.
Alright, so Mr. Dawson in room 12 had a stable night, with oxygen levels within the normal range. He tolerated his medications well, but he mentioned mild chest discomfort this morning. Not severe, but enough to note. The doctor has ordered an ECG and blood tests, which should be done by noon. Keep in mind that he's on a fluid-restricted diet, so remind him to track his intake. Also, if his discomfort worsens, notify the doctor immediately.
Now look at question 30.
Mr. Lawson, this medication should help regulate your blood pressure, but let's go over some possible side effects. Some people feel a bit lightheaded, especially when standing up quickly. If that happens, just take a moment before moving. A few patients also report a dry cough, which isn't serious but can be persistent. If that becomes bothersome, let me know, and we'll discuss alternatives. You shouldn't stop the medication abruptly, though, as that could cause your blood pressure to spike. It's also important to take it at the same time each day, preferably in the morning. Any concerns?
Extract 1, questions 31 to 36. A senior pain specialist is giving a lecture to medical trainees about chronic pain management strategies. You now have 90 seconds to review questions 31 to 36.
Listen to me more. Good afternoon, everyone. Today we'll be diving into the complexities of chronic pain management, a field that has evolved significantly over the last few decades. Chronic pain, by definition, persists for more than 3 months and can be quite debilitating, affecting not just physical health, but also emotional well-being and social functioning. Traditionally, opioids were the cornerstone of pain relief, but as we've seen in recent years, their risks often outweigh their benefits. Issues such as tolerance, dependency, and side effects like drowsiness and gastrointestinal discomfort have led us to shift towards a multimodal approach. So what does multimodal pain management entail? Essentially, it means incorporating different strategies rather than relying solely on one method. First, let's discuss pharmacological options. We know that nonsteroidal anti-inflammatory drugs, or NSAIDs, have been effective for many patients. However, their long-term use is problematic, particularly for individuals with gastric ulcers or renal impairment. We must assess each patient's risk factors before prescribing them. Then, there are adjuvant medications like antidepressants, amitriptyline, for instance, and anticonvulsants such as gabapentin, which are especially useful for neuropathic pain. That said, medication alone is rarely the answer. We also emphasize non-pharmacological approaches. Cognitive behavioral therapy, or CBT, is one of the most widely studied techniques in this area. It helps patients manage their perception of pain, reducing distress and improving overall function. We've seen great success in integrating psychological therapy with other treatments. Additionally, graded exercise therapy is another cornerstone of pain management. However, it must be individualized. Some patients, particularly those with conditions like fibromyalgia, may experience symptom flares if they overexert themselves, so we need to start slow and increase activity gradually. Another important but often overlooked aspect is interventional pain management techniques. Nerve blocks, epidural steroid injections, and spinal cord stimulation can provide relief in certain cases. However, these should not be first-line treatments. Instead, we reserve them for patients with refractory symptoms that do not respond to conservative therapy. It is also critical to acknowledge the biopsychosocial model of pain. Chronic pain is not just a physical phenomenon. It is influenced by psychological factors such as anxiety and depression, as well as social factors, including work stress or family dynamics. We must consider these aspects when formulating a treatment plan. So, in summary, personalized treatment is key. There is no one-size-fits-all approach, and balancing the benefits and risks of each treatment is crucial. Now, let's examine a case study to see how this approach works in practice.
Extract 2. Questions 37 to 42. You hear an interview with a leading cardiologist, Dr. Harper, discussing preventive strategies for heart disease. You now have 90 seconds to read questions 37 to 42.
Dr. Harper, welcome to the program. As you know, heart disease remains the leading cause of death worldwide. In your experience, what are the most effective prevention strategies?
Thank you for having me. Yes, cardiovascular disease continues to be a major public health challenge. Prevention is critical, and we emphasize lifestyle modifications as the first line of defense. That includes a heart-healthy diet, rich in fruits, vegetables, whole grains, and healthy fats, and regular physical activity. Research consistently shows that just 30 minutes of moderate exercise most days of the week can dramatically reduce cardiovascular risk. Beyond that, maintaining a healthy weight, managing stress, and ensuring adequate sleep also play crucial roles in cardiovascular health. Studies indicate that chronic stress and sleep deprivation can contribute to hypertension and inflammation, which are significant risk factors for heart disease.
And what about smoking?
Smoking is one of the most significant modifiable risk factors. It damages the arteries and accelerates atherosclerosis, increasing the risk of heart attacks and strokes. Even reducing smoking helps, but complete cessation is ideal. We encourage patients to seek support, whether through nicotine replacement therapy or counseling. Behavioral interventions such as cognitive behavioral therapy have also shown promise in helping individuals quit smoking successfully. Furthermore, secondhand smoke exposure should not be overlooked, as it can also contribute to cardiovascular problems, especially in vulnerable populations such as children and the elderly.
Many patients ask about statins. Should everyone with high cholesterol be on them?
Not necessarily. Statins are highly effective, especially in high-risk patients, such as those with diabetes or a history of heart attack. However, in individuals with only mildly elevated cholesterol, lifestyle changes alone might be enough. It's about personalized treatment rather than a one-size-fits-all approach. The latest guidelines emphasize the importance of risk assessment, which takes into account not just cholesterol levels, but also factors like age, blood pressure, smoking status, and family history of heart disease. There are also non-statin alternatives, such as PCSK9 inhibitors, that may be considered for certain high-risk patients who cannot tolerate statins.
There's been debate about low-dose aspirin for prevention. What's your take?
That's a great question. Recent guidelines have become more cautious. For patients without a history of cardiovascular events, the risk of bleeding may outweigh the benefits. However, for those with previous heart attacks or strokes, aspirin remains a key part of secondary prevention. It's also worth considering aspirin in certain high-risk patients, such as those with multiple risk factors for heart disease but no prior cardiovascular events, though this should be discussed with a healthcare provider. Additionally, ongoing research is exploring whether certain genetic markers may help predict which patients would benefit most from aspirin therapy, while minimizing the risk of bleeding.
What role does mental health play in heart disease prevention?
Mental health is an often overlooked aspect of cardiovascular care. Conditions like anxiety, depression, and chronic stress can lead to unhealthy behaviors such as overeating, smoking, and a sedentary lifestyle. Additionally, stress hormones like cortisol can contribute to increased blood pressure and inflammation, further raising the risk of heart disease. We now recognize the need for a holistic approach that integrates mental health care into cardiovascular prevention strategies. Mindfulness, meditation, and cognitive behavioral therapy are emerging as valuable tools for managing stress and improving heart health.
That's a fascinating point. How about dietary trends? There's a lot of debate around low-carb versus low-fat diets. What does the evidence say?
That's another great topic. While there's no universal diet for everyone, research supports the Mediterranean diet as one of the most heart-healthy eating patterns. It emphasizes healthy fats like olive oil, lean proteins, whole grains, and plenty of vegetables. Low-carb diets can be effective for weight loss and improving metabolic markers, but they need to be approached carefully to ensure adequate fiber intake and heart-healthy fat choices. The key is sustainability, finding a diet that a person can maintain long-term while meeting their individual nutritional needs. Additionally, reducing processed foods and added sugars is universally beneficial for heart health.
One last question. What advancements in heart disease prevention are you most excited about?
We're seeing exciting developments in several areas. Advances in genetics and personalized medicine are allowing us to better assess individual risk and tailor prevention strategies. Wearable technology and mobile health apps are also transforming how we monitor heart health, from tracking physical activity to detecting irregular heart rhythms early. Additionally, New medications and therapies, such as anti-inflammatory drugs targeting cardiovascular disease, are showing promise. So the future of heart disease prevention is becoming more proactive and personalized, which is a promising shift in the field of cardiology.
Thank you for your incredible support. Your likes, shares, and subscriptions inspire us to create even more valuable content. Keep supporting us and we'll keep bringing you the best.